Angelique here, and I wanted to come on today to chat about the topic of vaginal dryness. So there have been a few individuals in this community that are struggling with vaginal dryness concerns, and I wanted to cover that today because, of course, vaginal dryness can be a huge contributor to painful penetration. So today I wanted to talk about 3 causes of vaginal dryness that you may not be aware of, but is contributing to this problem. So the first one is medication. Okay, so a lot of individuals may be using all sorts of different kinds of medications. We know that there's a ton of side effects with medications generally, but some of the common ones that I find some of my clients struggle with that can contribute to vaginal dryness are cold and allergy medications, so antihistamines, some anxiety and depression medications, as well as some bladder medications. So some of my clients that are on overactive bladder meds or medications to help with their urinary incontinence or bladder leakage issues. Some of these medications can, as a side effect, have or increase vaginal dryness for people. Okay, so that's one. The second one is smoking. So smoking is anti-estrogenic. So what does that mean? Smoking actually influences the amount of estrogen produced in the body. And so when there's less estrogen being produced, of course, there's less circulating estrogen in our body, and that can contribute to vaginal dryness. So similar to somebody going through menopause, as we all know, there's a decline in estrogen around menopause, and decline in estrogen can create all these changes in the pelvic area, including vaginal dryness, decreased lubrication, and changes in the elasticity of the tissue there. So again, that's the second cause, smoking. And then the third cause I wanted to chat about today is excessive stress and anxiety. So excessive stress can influence vaginal dryness. And that's because when we are in high states of stress or anxiety, that can really change the hormones and the fluctuations in hormonal levels in the body. For example, cortisol, as well as testosterone. So with testosterone, if there are lower levels of testosterone, that can influence our libido, our desire and arousal. These fluxes in hormonal levels can also influence the amount of lubrication in the area of the pelvis, but also blood flow to that region. And so all of that can absolutely influence vaginal dryness. Okay, so something to take note of. I mean, there are some of these things that we've discussed today that you may be able to make changes to, and in some cases, perhaps medications, you may not, but it's a good thing to be aware of because, as I mentioned earlier, vaginal dryness is a big concern for people that are struggling with painful penetration.